Ready? So I am looking at my patient's chart. I see that I have Mrs. Afna. She's 80-year-old female. She's complaining of left lower quadrant pain. I'm looking at all of this chart. I see that there's some past medical history, tests, that kind of stuff. So I am centering myself. So I've looked at my patient's chart. I have hand wash. You don't have to hand wash. You just have to state it. And I'm walking into the patient's room. As I'm walking into the patient's room, I'm assessing the situation. My patient, Mrs. Afna, she doesn't look like she's in that much distress. She looks comfortable in the bed. She's not yelling out. Before I walked in, I made sure my isolation precautions, so there was no isolation precautions, so I'm good to walk in. There's nothing urgent that needs me right away. So I've centered myself. Now I'm going to introduce myself. So hi, Mrs. Afna. My name is Nicole. I'm a registered nurse here at Georgian College, and I'm here to take care of you. Can I just get your first and your last name, please? Great. And also, when were you born? And I can check with either the bracelet or my patient's chart. So I hear that you're having some abdominal pain. Is that right? Okay, and then can you point to me where it is? Some kind of, okay, it's right there. Okay, so what I'm gonna do for you today is I'm gonna do an abdominal assessment. So I will be asking you a few questions. I will be listening to your stomach as well, and I will be tapping it and also touching it a little bit. So maybe in those painful areas as well. So this should take no longer than 10 minutes. At the same time, I'm also gonna be writing some notes down. These notes are meant to go into your chart where the doctor will be able to access that. So all of the information that I'm collecting, it is confidential and will remain in your chart for only your circle of care to see, okay? Do you have any questions for me? No? And do I have your consent to proceed? Yes, great. So now I am going to do my inspection. So it's just a general survey. So technically I should be, stepping back. So in terms of physical appearance, I'm looking at my patient. I see that their age, is appropriate for their stated age, or their appearance is appropriate for their stated age, and so is their height and weight is proportional. In terms of behavior, I see that my patient is cooperative and alert, and they're maintaining good eye contact. In terms of body structure, I see that my patient is symmetrical in the bed, that they're lying comfortably in the bed, that there's no distress there. And in terms of their gait, I didn't really see Mrs. Afna walking in, but I can also maybe talk about her upper and lower body strength. So as we were having that conversation, I can say that she's got good upper bilateral strength. Maybe we could say the same thing about the lower body as well. Otherwise, I'm not really sure what else to say, if they had a steady gait or not. Okay, so I will start. Ooh, should have brought those in with me. Okay, so Mrs. Afna, if you're okay with it, I'm just gonna lift up your gown a little bit so I can take a listen to your stomach. I would also confirm, make sure, where is that pain located? We'll point to the left lower quadrant. Okay, so I'm putting on my stethoscope the right way, and I'm starting with the diaphragm. So I'll pretend like my stethoscope is in, and diaphragm. Washing it, warming it up. Okay, listening to bowel sounds. I hear bowel sounds. I hear bowel sounds. I hear bowel sounds. And I hear bowel sounds. Doesn't matter how long you listen for, as long as you're listening to determine if it's a normal bowel sound, hypo or hyperactive. Great, okay. Now I'm moving on with the bowel. I'm listening for vascular sounds. So I'm listening to the aortic vascular site, renal, iliac, and then femoral. Here I'm listening for a brewery, a blowing, swishing sound, which I do not hear. So in terms of auscultation, I heard normal bowel sounds in all 4 quadrants, and I heard no breweries, which is also normal. If I did hear a brewery, that could indicate a stenosis, or the narrowing of that artery, or also an aneurysm. Great, thank you. Next, I'm going to be doing percussion. So I'm just going to be tapping in those same quadrants, starting in the right lower. Great, and so here I'm assessing for the density of any organs in size and location. So I heard timpani sounds in all 4 quadrants, which is a normal finding. If I heard dullness, that would be an abnormal finding, which could indicate ascites at the flanks of the abdomen. Next is palpation. So in this one, I can get you to just flex your knees for me, Mrs. Abna. And at the same time, I'm going to be pushing onto your stomach. So just let me know if there's any pain. Here I'm assessing for any superficial lumps, bumps, masses, mostly tenderness. I'm looking at my patient, looking for any grimacing. Yeah, was there any pain at all? No? That's great. Great. Okay. If there was any abnormal finding, it would mostly be due to tenderness. So I would want to note that. Okay, great. Thank you, Mrs. Abna. I'm going to go report that to the doctor now. So, hi, Dr. Smith. My name is Nicole. I'm a registered nurse calling from Georgian College Hospital. I'm calling in regards to your patient, Beverly Abna, 80-year-old female, in room 105, bed 4. I'm calling you because I'm concerned about her pain and her abdominal pain. She was admitted yesterday with left lower quadrant pain, and she's awaiting surgery. In terms of past medical history, she does have the cholecystectomy that she's waiting for actually, and no relevant tests or results. Upon inspection, she was grimacing. Upon palpation, there is no tenderness. On palpation, timpani sounds were noted in all 4 quadrants, and bowel sounds were normal in all 4 quadrants as well. I'm really worried about her abdominal pain, and I was wondering if I could get some pain medication for good pain management. And he said, yeah. How long was that one?